So if you want to know the significant factor, how can we use only bar chart and line chart, correct? So we need to use some advanced statistical tool. Also, the accuracy of your result regarding this survey, accuracy of your result depending on sample size. I mean, depending on the response rate. Regarding this survey, which one is we need to check for high quality data? If you want to collect high quality data, which one is more important? The response rate. If you got just a 10% from radiology department, for example, total number of employees 400 in radiology department, but what is the response rate as per your survey? Just only 10%. So if you got 10%, is it possible to assess the exact culture, whether we can compare to other department from this low percentage of response? So these are all methodological issue. Conducting this survey is not a big challenge. We can send this questionnaire to all employees just by email. Then we can collect only 20 sample or 30 sample, even 50 sample. And we can show in front of JCA people or any beach people. But is it possible to improve your culture? If there is no positive culture in your department, for example, if there is no teamwork, if there is no communication, how can we improve our process? How can we collect data for our key performance indicator? So these are all depending on culture, correct? So let's see what are the standards from statistics regarding this survey. So there are two things we need to focus regarding survey on patient safety culture. For the accuracy of the result, there are two things we need to focus. One is high quality data. Second one is high quality analysis. This is not only for safety culture survey, for each and every quality practice. Without data, we cannot do our practice in quality, correct? For quality data is very important. But especially for safety culture survey, what is high quality data and what is high quality analysis? As a quality professional, what we need to do to collect high quality data? The only thing, response rate. What is your response rate? Is it 60% or 70% or 90% or 40%? Not only from the organization. Even if you got organization-wide 60%, the percentage of response from the whole hospital, 60%. But what is the response from each department? Whether you got 60% from each department, from each unit. So this is also more important. Regarding high quality data, the only thing we need to check response rate. Here we cannot use sampling method and we cannot calculate sample size. This is very clear even as per JCA and AHRQ standard, even from statistics. Please don't focus on only JCA and NABH standard or some other accreditation standard. We need to know the real practice from statistics, because this is about data analysis. If you want to know something about data analysis, why we need to focus on JCA standard? So we need to know what is the standard from statistics. So no need to calculate sample size. Because for culture, we need to know the exact level of culture from each and every employee. If we got 10% of response from radiology department, how can we assess the exact culture of radiology department? And how can we compare with the laboratory? 10% from radiology and 90% from laboratory. 10% of response from physician group, 90% response from nurses group. How can we compare? If there is no comparison, how can we improve? How can we learn from our data? The purpose of data collection to learn from your data, to provide lesson to your employees, to satisfy your customers, correct? So if you're going to conduct patient safety culture survey, the first thing we need to check the response rate. This is more important for the accuracy of the result. Actually, regarding this survey, we have three different parts. The first one is before survey. As a quality professional, as a patient safety officer, what are things we need to do before conducting this survey? Point number one, education to all staff and physicians, especially for physicians. This is more important. We should provide clear education about safety culture survey. Why we are conducting this survey? What is the purpose of this survey? This is not just because of any which standard. This is to build system in our organization. This is for our customers. This is to build teamwork. This is to improve the communication between the patients and, between the care provider and care receiver. Because if you do culture survey, we can able to assess the level of communication. We can able to assess the level of teamwork from each department. As per JCA report, lack of teamwork and communication is the main cause for most of the sentinel event. Lack of communication and teamwork is one of the root cause for most of the sentinel event. How can we assess teamwork and communication? How to collect data? The only option is safety culture survey. But before conducting this survey, we need to provide clear education. As a risk management, as per international practice, this should come under risk management, not under patient safety or quality people. No. Who is the one responsible to conduct the survey? Risk management. Sometimes we can establish separate team for patient safety culture, like international patient safety goal. Safety culture team. We can create team like this. This is more important. This is the foundation for quality and patient safety as well as for risk management. Without assessing this culture, what is the use of implementation of excellent policy? What is the purpose of assessing credential and privilege? What is the purpose of implementation of EMR and CPOE? What is the use? There is no culture from our physician. Even if you implement CPOE or EMR, is it possible to get 100% compliance? So this is more important. But if you conduct the survey without education, mostly we'll get false result. This is like survey. We can use AHRQ tool, and this is follow Likert scale. So totally there are 5 points for each question, like strongly agree, agree, neutral, strongly disagree, and not applicable. This is exactly Likert scale. But sometime, if you send this questionnaire to employee without education, what they will do? Simply they will choose, yes, strongly agree, without understanding the meaning of the question. So as a quality professional, we need to teach each and every question. What is communication? What is response to error? What is handoff? So we need to teach each and every area. And how many questions in AHRQ? Why we need to use AHRQ tool? So education is mandatory. Then total employees from each unit as well as department. Now we need to know the population size. As a risk management professional, we need to collect the total population size from each department. Like what is the total number of employees in radiology, cardiology, nephrology, clinical, non-clinical, including quality. List out total employees from each one. And what is the total from our organization wide. Because without population size, how can we calculate the response rate? Correct? Response rate is equal to, what is the formula? What is the basic formula for response rate? What is the basic formula for response rate? How to calculate response rate? As I mentioned, response rate is more important for the quality of this data. How to calculate response rate? Numerator is number of people responded. Over what is the denominator? Total number of employees in your organization. Yes. So we need to know the response rate. But if you want to calculate the response rate, first we need to define our population size. Okay, the next point, number 3, engage leadership. As a risk management professional, we need to collaborate with the other stakeholders. Even we can discuss with each and every department director. And provide resources. Announcing the purpose of the survey and encouraging staff participation. You know, this is one of the responsibility of leadership, the top management. They should send clear communication regarding the importance of the survey. If there is no communication from top management, who will respond? They should allocate resources, even manpower, to conduct the survey, even some software for analysis. We cannot use Excel. No more Excel. Excel only for data entry. But if you want to buy some software, we need support from our top management, correct? So providing resources, sending communication. The next one is keep your promotion communications. Sometime we can provide some rewards also. Or we can create awareness. We can send some message to all employees regarding this survey. Why we are conducting this survey? What are the similar studies available in our country? What are the features from this survey? So we can send some message daily before conducting the survey. We can send some message to all employees by email or even We can publish in our newsletter, or we can discuss in the safety meeting, or we can discuss in the quality and patient safety meeting. Because as per JCA, every quarterly once, every 3 months, quarterly once, we should conduct quality and patient safety meeting. Use both web and paper-based survey. This is the exact recommendation from AHRQ. Don't use only electronic, web-based or only paper. This is one of the important strategy for high response rate. Really, if you need more response rate, better to use both mechanisms. Because sometimes it's very difficult to get response from our housekeeping people, even from security. If you send by email or if you send some Google form or some other things, it's very difficult to get response from non-clinical people, especially from security and housekeeping. So we can use paper also. So better to use both. This is one of the strategy for the response rate. If you want to increase response rate, yes, this we can do. Yes, provide survey incentives, yes. This is also we can do, because as per research, there is research regarding this issue. How to increase response rate, how to engage our employees, how to get support from our employees regarding this survey. Provide incentives. Because for quality practice, appreciation is more important. Appreciation, rewarding system, supporting system. So we can provide some rewards. We can provide some gift voucher or even half day or 1 day off. We can do as per our organization by law. The next point, include your CEO or medical director signature on the survey invitation email. So even as a risk management professional, if you're going to send your questionnaire to all employees, send through medical director with his signature. Don't send directly to all employees. This is also one of the strategies to get immediate response from our employees, correct? And even we can conduct a campaign to announce the survey through multiple sources such as email, newsletter, message board, website. Yes, we can share. If you're going to conduct the survey probably after 1 week, now we can start. The campaign we can start now. Yes, we can send daily reminder. Yes, we are going to conduct the survey soon. Don't send only by email. Multiple source. Identify survey champions in every department to promote the survey and encourage participation. Yes. Sometime we can assign someone to manage the survey from each department. Like for nursing department, we can assign someone to manage the survey. Responsibility. We can assign someone. Even from radiology, even for emergency department. Survey champion, yes. Then conduct a pilot study to validate the survey tool. Before going to the main study, we need to conduct a pilot study. Why? What is the purpose of pilot study? For pilot study, we can choose at least 30 sample or 50 sample from different department, correct? As per our convenient. Even we can use convenient method, nothing wrong, because this is just a pilot study. But why we need to conduct pilot study? This is to validate your tool. Even if you're going to use AHRQ tool, without validation, we cannot use this tool in our organization. This is from America. This is from different setting. How can we use this tool without validation? We need to check whether we can use this tool in our organization. We have different patients, different setting, different leadership. How can we use this tool without validation? Yes, as per research, AHRQ tool is highly reliable. There is no doubt. But as a researcher, as a quality professional, what we need to do? First, we need to validate whether we can use this tool. So even for validation, we can do separate analysis. There is system and guideline and statistics for data validation. If it is valid, if there is no problem in your questionnaire, then we can collect data from all employees. Now we can start our main study. Yes. The next one is the last point. Highlight the benefit or changes that resulted from the previous survey effort. This is more important for response rate. Actually, these are all different strategies to increase your response rate. Highlight the benefit or changes that resulted from previous survey effort. What are things we learned from our previous survey? What are the benefit? Or what kind of action we prepared and implemented? Even we can compare the culture and the performance indicator outcome. Yes, there is improvement in hospital acquired infection. There is reduction in sentinel event. There is reduction in adverse event. This is because of culture. Sometimes we can compare positive culture over a period of time from 2000 to or from 2010 to 2020. Positive culture over a period of time in 2010, it was just 40%. We can draw even trend line. Yes, over a period of time, the positive culture is like this. And what about your performance indicators outcome? If it is close to your culture, if both are changing in same direction, oh, excellent. So there is no problem in your data. There is no problem in your culture survey data, because there is impact in our performance indicators. If both are in opposite direction, something wrong in your safety culture data. So these are all we can do before survey. If you're going to conduct patient safety culture survey, if you focus on all these points, if you prepare answer for each question, probably we can able to collect high quality data. Now let's see what are things we can do during the survey. Yes. Now we are collecting data from each employee as well as from physician. So what are things we can do now? Track survey response by department throughout the data collection and focus promotion efforts where you need to increase response. Daily, we need to calculate the response rate from each department as well as organization wide. After initiating the survey, we need to calculate the response rate, how much overall and how much from each department. Discuss with the concerned department. Suppose if you got low response from radiology department, discuss with the concerned department, discuss with the champion, survey champion, why it was like this, what is the problem, what they want. Send reminder to survey champion. Yes, distribute response rate report by department to allow them to compare to one another. Yes. If we calculate the response rate from each department, after calculation, what we need to do? Just share to all department. Or we can send by email to all stakeholders, department directors, with some recommendations. So if you do all these things, probably we can able to get more response rate. This is also we can do to collect high quality data. As I mentioned, high quality data depending on response rate. This is not like other survey. If it is patient satisfaction, we can calculate sample size. We can use some sampling method, but for safety culture survey, no. Even as per international practice, we need to collect data from each and every employees as well as from each and every physician. Now let's see some recommendation from statistics. This is survey. Survey is one of the method of data collection as per statistics. After data collection, what we need to do? We need to know how to enter this data, which type of spreadsheet we can use to enter this data, how to validate this data, is there any coding, and how to analyze. Which statistical tool we can use to analyze this data. So this is more important. Regarding data entry, if you're going to enter this data, we can use Excel for data entry, nothing wrong. Excel is user-friendly, so there is no much complications. For data entry, we can use Excel. Or if you're going to collect data by Google form, yes, we can export to Excel format. This is also possible. But after data entry, we should use some statistical software for analysis. Because if you use Google Form or SurveyMonkey or some other online system, what they will provide just only percentage and the bar chart for each and every question. But is it effective approach? Is it effective analysis, efficient analysis? No. This is not the right time to focus on only percentage and bar charts. Now healthcare is a complex system. Too many patients, too much of infections, too much of expectation from our accreditation agency, too much of expectation from our insurance company, too much of expectation from our patients, even from employees also. So data-driven approach is the only solution now. So use some statistical software to do your analysis. Especially for this survey, we can use SPSS. SPSS we can use. SPSS. What is SPSS? Statistical Package for Social Science. This is one of the leading statistical software. Especially we can use this for research as well as for survey analysis, not for quality. So export your data to SPSS, then clean your data. Is there any missing item? Is there any comma, full stop? Because if there is any comma or if there is any mixed things, if it is not in the valid syntax, how can we do the analysis, correct? Also coding, what we need to do in SPSS, we need to create coding for each and every response. Like for example, question number 1, it's about experience, total experience in this organization. For example, question number 1, total experience in this organization. Option A, less than 1 year. Option B, 1 to 10 years. Option C, more than 10 years. Just for example. So this is the question as per HRQ. But for data entry, especially in SPSS, what we need to do, we need to assign code for each response. Like for example, we can assign one for code number 1 for option A number 2 for option B, number 3 for option C. So in the spreadsheet, we need to enter first column question number 1, and this is employee 1. So what is her response regarding this question? Suppose if we choose option A, we need to enter only 1. Don't put less than 1 or 1 to 10. No, this is not the valid format for data analysis. We need to convert into code. Even for gender, don't enter male or female in the spreadsheet. Spreadsheet to do analysis, not to show in front of others. The purpose of spreadsheet to do some analysis. So if you're going to do some analysis, we need to enter only data, number, numeric. Even if you're going to enter qualitative data, we should assign code. Yes, gender is qualitative. How to enter in numerical form? Yes, assign code. 1 for male, 2 for female. For example, the next one is gender. So what is the first employee? Suppose if it is male, just we can enter 1. Suppose if it is female, we can enter 2. So assign number 1 for male and 2 for female. So create coding before entry, before going to enter data, create coding for each and every question. Then enter 1 by 1. Okay. So data cleaning and coding. The next one is, if everything's ready, now we can calculate frequency and percentage for each and every question, especially for demographic variable. Not for each and every question, for each and every demographic variables. Because as per AHRQ tool, there are 7 demographic questions. Totally, there are 7 different demographic questions, which include total experience in your organization, even the working unit, department. So similarly, totally there are 7 questions. So what we need to do for each demographic questions, we need to calculate only percentage and frequency. No need to use any other statistics. Okay. The next one is positive score for each questions. Now we need to calculate positive score for each question, especially for culture questions, excluding the demographic. How to calculate positive score? For example, totally there are 10 different area. As per AHRQ tool, totally we have 10 different area. Like the first one is teamwork. First one is teamwork. Under teamwork, question number 1. For example, this is question number 1. This is question number 2. And what are the options? As I mentioned, this is Likert scale. So we have 5 options. Strongly agree, neutral, strongly disagree, and disagree. And there is one more, not applicable. Yes. So this is exactly Likert scale. So what we need to do for this, for the calculation of positive score, actually there are 2 different type of questions in AHRQ. Only one is positively worded and negatively worded. There are 2 different type of questions we can able to identify. One is positively worded and negatively worded. How to calculate the positive score for positively worded? Just add agree and strongly agree. For example, total number of employees responded 20. For example, total number of employees responded 20. Out of 20, 10 were choose strongly agree and agree. Only 10 were choose to strongly agree and agree. Probably 7 strongly agree and 3 agree. So we need to add both together for positive score. Because this is positively worded question. So just add strongly agree plus agree for all positively worded questions. So which is equal to 50%, correct? 10 by 20 into 100, 50%. So this is the positive score for question number 1, 50%. Similarly, what we need to do for negatively worded questions? For negatively worded questions, we need to add strongly disagree plus disagree. So what is the total responses from strongly disagree and what about disagree? Just opposite to positively worded. So this we can use for negatively worded question. Very simple. For positively added question, just add strongly agree and agree. So this two will take as positive response together. And for negatively worded questions, strongly disagree and agree. So this is what we need to do. There is option in SPSS. Within a minute, we can calculate everything. No need to spend 2 hours or 3 hours, not like Excel or some other spreadsheet. But this is the basic formula for the calculation of positive score as well as positive score for positively worded questions. Similarly, positive score for negatively worded questions. Yes. Okay. So now we have positive score for each questions as well as area. Area means like communication. What is the positive score regarding communication? What is the positive score regarding teamwork? What is the positive score regarding response to error? Yes. So if we have positive score for each question and area, now we can summarize. This is more important statistics. Summarize. After calculating positive score for each question as well as for area, we need to summarize our data because we have 1,000 sample. How can we write conclusion for each employee? No, we need to summarize. For example, for teamwork, how to summarize? How to summarize? Just calculate an average. For example, 70.5%. This is the average. Within bracket, the standard deviation, for example, 10.4. So use both. We cannot use only mean. Because for quality, which one is more important? Variation, correct? But what is going on in the current scenario? Always people will use mean. An average percentage of teamwork, 70%, average of communication, 60%. So there is problem in communication. No. This is not the appropriate one. We need to know the variation. So regarding teamwork, how to summarize this data? Just calculate average score and what is the standard deviation. This is for overall. Also, we need to, regarding teamwork, we need to calculate what is the positive score from each specialty, from each department. Regarding teamwork, we need to know what is an average overall and what is the positive score from each department. For example, radiology, how much? We can prepare a table like this. Even we can use some dashboard also. Just list out all department: radiology, laboratory, emergency, even clinical department, cardiology, internal medicine. Yes. So here we can list out all area, teamwork. The next one is communication. Next one is response to error. So what is an average teamwork from radiology department? Regarding teamwork, what is an average score, positive score? Like for example, 60, 64, not only average. present standard deviations also. Use both. Don't use only mean. We cannot simply use mean for comparison. If you are going to compare two different departments, which one is more important? The variation. So what is an average from radiology department and how much the standard deviation? Like for example, 10.1. What about from laboratory? Like for example, 80. What is the standard deviation? 50.4. 50.4. Similarly from each department. So we can prepare like this. And how to write the conclusion after preparing this table? Even we can use, totally there are 10 different area in the safety culture survey tool, which include teamwork, communication, response to error. Similarly, totally there are 10 area. Now, what is my question? As a quality professional, I want to present this 10 area. I want to know which one is good, which one is not good. Which one is I need to focus first. Now tell me which graphical representation we can use for this purpose. What is my purpose? I want to see all 10 area in one picture. Regarding positive score from all 10 areas, I want to visualize. I want to see all 10 area regarding the positive score. Which graphical representation we can use? Because for communication, for sharing, even if you're going to send this report to top management, instead of table, if you send by graph, probably we can able to understand easily, correct? So which graph we can use to summarize your positive score for all 10 areas? Dr. Goya sir, how can we use bar chart? Because if you use bar chart, is it possible to show standard deviation in bar chart? As per your response, we can do like this, correct? Dr. Goya sir. So as per your response, we can prepare bar chart like this for each and every area, correct? Together. This is for teamwork.
Comparison.
This is for communication. This is for response to error. We can show like this, correct?
Yeah.
But is it more appropriate, sir? Because there is no standard deviation. As per statistics, we cannot use mean for comparison. This is very clear.
True.
But if you use bar chart, how can we show variation?
Right.
Correct? So this is not the appropriate one. But which one we can use? What about from others? Control chart for time series data, sir. Sir. Control chart for time series data. Control chart simply we cannot use for comparison of different variables. So here totally we have 10 different variables, 10 different area. Teamwork, communication, response to error. Just I want to compare. How can we use control chart? This is not time series data, correct? This is comparison. The keyword is comparison. But comparison mostly we can use bar chart, but the problem, if it is number of patient, okay, we can use, suppose if you want to show the number of even response rate, if you want to show the response rate from each department, probably we can use bar chart. Nothing wrong. But here, what is my purpose? I want to know which ones I need to focus first. I'm going to recommend action. For improvement, for continuous quality improvement, I'm going to recommend some action. But without knowing the root cause, how can we recommend action? So Parrot chart, how? This is, my purpose not to know the exact problem. I have positive score from each area. please try to evaluate each and every factor. Simply, if it is comparison bar chart, if it is quality, yes, control chart, no. Please try to understand the scenario. The scenario, this is about positive culture score. And we have 10 different area. I want to compare because I want to know which one is the problem, which one is we need to focus. So how can we use Pareto chart? Here there is no cause. How can we use Pareto? Pareto only for frequency of problem, correct? If there is any frequency, the reason for teamwork, a reason for communication problem, if there is any reason, list of reason from each and every employee, probably we can use Pareto chart, correct? Yes, the only option is box plot we can use. Box plot. This is box plot. Even we can construct this in Minitab as well as in SPSS. Because in box plot we can show both median as well as even mean also we can show mean as well as median and variation. This is possible. See here, actually suppose if you have continuous data and more than one group, more than one variable. Generally for continuous data, we can use histogram, correct? We can use histogram for continuous data. But here we have more than one variable like teamwork, communication, response to error. So how can we use histogram? Histogram for only one variable. But here we have more than 10 variable. So which one we can use instead of histogram? Box plot. Actually in box plot, we can able to show both center as well as variation. So this is the minimum number and this is the maximum number. The distance is variability, correct? Here this is the minimum number and this is the maximum number. The distance is variability. If you compare these two, we have problem in teamwork. There is huge variability, correct? Even box plot we can use for the comparison of department. So this is the box plot for teamwork. This is the box plot for teamwork. What is my first radiology? The first one is radiology. Next one is laboratory. This is the box plot for radiology and this is the one for lab regarding teamwork. Now tell me, which one is we need to improve? So here what is an average positive score? For example, 60%. This is just 40%. Now tell me which one is we need to improve. For which one is we need to investigate. Whether we need to investigate, whether we need to start investigations for radiology or laboratory. If you focus on mean, 60-40, I think we need to investigate laboratory. But what about the variability? Even if there is less, overall the positive score from laboratory is very, very less. But variability is not like radiology department. So for example, an average positive score in in radiology is 60 with a standard deviation of 30.1. This is by number. What about in lab 40 with a standard deviation of 1.5? Now tell me as a quality professional, which one is we need to focus? Yes, Dr. Gaya sir. Tell me now. Which one is
Sir, radiology.
radiology? Why?
There is more variation.
Uh, there is variation among the staff. This is not at all good for quality practice. Even if there is difference in the mean, we can improve. Mean is not a problem. This is very clear. Overall, there is problem in laboratory. Compared to radiology, we have problem in lab. There is no doubt. But this is acceptable. This is the opportunity for improvement. We can improve. But variability 30 and 1.5, this we cannot accept. Which means culture from radiology department. You know, the culture of each and every employee in radiology vary from each one. There is no similar attitude. People are varying. There is no teamwork. So we need to do something for radiology department. We need to investigate why it was like this. Why there is huge variation among the employees. So now we can recommend action plan to reduce the variations. So if you're going to recommend actions, focus on variation. Don't focus on mean. Because as per Dr. Deming, we need to give more importance for variation, not for mean. Yes, what else we can do from statistics? Yes, use box plot for comparison of all area. Don't use bar chart or control chart or Pareto chart. Use some inferential statistics. Even box plot, just visual representation. After box plot, we can use some inferential statistics like t-test, ANOVA. Because if you use ANOVA test, we can able to calculate the p-value. Suppose if the p-value regarding teamwork among all department more than 0.05, what does it indicate? There is no significant difference among the department. This is very simple. Just calculate p-value for teamwork comparing all department. And if the p-value is more than 0.05, excellent, there is no problem. So no need to worry about teamwork. Just move to next area. Communication. What is the p-value regarding communication from all department? Less than 0.05. Oh, there is problem in communication. Now we can compare. Now we can use some other tool also to know the exact department. Where is the problem? ANOVA we can use to check the significant difference among all department. But if you want to know the exact thing, we can use some other statistical tool. Which one is more away? This is also possible in inferential statistics. No, this is what we need to do in evidence-based approach. But what is going on in the current scenario? Just data collection as per our convenience, just from 30, 20 people or 50 or even 100 employees, conducting survey by Google form. From Google itself, we can able to get some percentage and some bar chart and preparing some report and sending to top management, or just sending to NABH or some other accreditation agencies. If you do like this without clear methodology, without high quality data, without, why we need to use box plot and other statistical tool for high quality analysis? Both are very important for the accuracy of the result. So if you have high quality data and if you do high quality analysis, definitely we can able to know the exact problem. Why still there is no reduction in medical error? There is checklist for each and every practice. There is clinical pathway for high-risk procedure. There is standards from JC and NABH, but still there is no culture among physicians. There is no clear communication between physician and nurses. There is no engagement from our patients. There is no clear communication between the patients and the physicians. No disclosure policy. Why? This is because of lack of data-driven approach. So if you're going to learn from your data, definitely we can able to get many things. So this is the secret in data-driven culture. So after the survey, yes, this is the last. After survey, what we need to do? Yes, now we have everything. There is positive score and there is positive score from each department, and there is comparison, there is p-value, there is a standard deviation for each one. Excellent. Now, what we need to do? Immediately distribute the survey results to all staff. Provide department specific result. Sharing. This is more important. If you share only in front of JC or any which, what is the use? People will prepare survey report, safety culture survey report only at the time of accreditation. And they will show only in front of surveyor. What about employees? If you do like this, how can we conduct next survey? Who will support? And sometimes we can prepare separate report for each department. What is their level of teamwork? What is their level of communication? What is their level of response to error? Prepare separate report for each, at least for the main department, like for radiology, laboratory, emergency. Then engage staff in action planning effort. Yes. To improve patient safety culture within the department and across the organization. Implement action plan and evaluate. So if you're going to prepare action plan, we should include all stakeholders, at least the department directors. Sometimes we can prepare separate action plan for a specific department. Suppose if there is major problem in radiology department, or if there is problem in laboratory, if we got more variation among the staff, we can recommend separate action plan for laboratory, separate list of actions for the hospital wide. This is like strategic plan. Sometimes strategic plan we can prepare for each department also, possible, correct? So prepare your action plan and implement. After implementation, we need to assess. How to assess? After implementation of action plan, just to check your key performance indicator. What about the outcome from radiology department and laboratory? So for example, totally we have 10 indicators from lab. So what is the target for each indicator? Like for TAT, lab TAT, what is the target? Less than 10 minutes. What is the actual outcome now? 44 minutes or 30 minutes, for example. And culture is excellent, 90%. What is this? As per culture survey, 90% positive culture from lab, for example. But TAT target is less than 10%, 10 minutes, but the actual is 44 or 30 minutes. This is extremely away from the target, but the culture is 90%. No. So as per research, as per statistics, there is strong relationship between the culture and the process outcome. So this is the message from this webinar. So try to collect high quality data, not only for culture survey, even for each and every performance indicators for other quality practice. The accuracy of quality outcome depending on your methodology. If you use proper methodology, definitely we can able to collect high quality data. High quality data is one of the important characteristics for highly reliable organization. If you want to become highly reliable organization, if you want to provide best things to your patients, try to collect high quality data. Don't collect data just to show in front of enabled people. So this is the key message from this webinar. Any questions, please? Any questions regarding this data collection and analysis?
Hello.
Yes, Dr. Subhani, ma'am. Yes, ma'am.
Sir, can you give 2 or 3 examples to elaborate this with examples of survey?
Example for what? Survey means what? For each area or?
Any. Just example to clarify a little bit concept.
No.
Like teamwork you did, na? So like more
Okay.
examples. Yeah.
Similar approach we can do for each and every area. This is like formula. If you are going to calculate positive score for teamwork, similarly we can do for other area. There is no different formula for each area, correct? We need to calculate the positive score for other area. Like for example, regarding response to error. So how many questions as per AHRQ tool? Totally there are 4 questions under response to error. So we need to calculate what is the positive score for each question. First, we need to calculate what is the positive score for each question. Question number 1, what is the positive score? 60%. Then what about question number 2? Question number 2, 70%. Not only mean, use both mean as well as standard deviation. For example, 1.5 or 1.4, 1.7. Similarly, for question number 3, 81 with a standard deviation of 10.5. Question number 4, for example, 78 with a standard deviation of 1.5. So this is for each question. Now we need to calculate what about the overall. How much for overall regarding response to error? For example, 80% with a standard deviation of 11.1. Here the problem, if you're going to compare among the department, regarding response to error, I want to know what is the response from each department. So for this comparison, don't use only mean. This is the problem now. Don't use only mean. For comparison, even if you're going to do some research, no one will accept only mean. We need to show both mean as well as standard deviation. Only from standard deviation we can able to see the variation among the employees. Suppose if we got 0, the overall score regarding response to error 80%. For example, overall score regarding response to error 80%. With a standard deviation of 0 means, what does it mean? Excellent. There is no variation among the staff. This is the perfect model. We should learn how they got. As a quality professional, we can recommend this department. For further improvement, we should learn how they got. This is the excellent department. Even this is, for example, from radiology. Suppose for laboratory 100%, but the standard deviation 50% or even 10%. No, okay. Lab is not a best model. We cannot recommend laboratory for lesson. Don't share laboratory practice to others. We need to share only radiology because there is no variation. Even if you're going to prepare lesson learned, we should focus on radiology department, how they got. So try to learn their practice and share to others. This is what we need to do. But this is totally against the current practice. Because currently what is going on, people will use always bar chart with the mean. But if you focus on mean, how can we improve? So this is the problem. Is it clear, Dr. Subhangi ma'am?
Yes, sir. Yes, sir. Thank you. Actually, I wanted little different examples. That's okay, sir. Sir, these results can be published.
Yes, we can publish.
This can be published.
Yes, yes. You know, instead of conducting the survey for your organization, now we can conduct the survey among quality professionals in India. The perceptions regarding safety culture, among healthcare quality professionals in India. This we can do. Very important, because many quality professionals not aware about the importance of safety culture survey. They know, oh, this is just for JCI, NABH. Oh, this is the new standard from NABH. We need to conduct the survey. Yes. But this is not the purpose of safety culture survey. This is to build a system in your organization. To build a structure, you know, the structure is more important. Before process and the outcome, we need to focus on structure. So for structure, which is more important? The culture. So if there is positive culture, definitely we can able to build positive structure, and we can do better process, and we can reduce outcome also. Yes, Dr. Reshma ma'am, any questions, please?
Yeah, thank you so much.
No, sir, no question. Only, yeah, because we need to have a software to analyze this data.
Yes.
That is very important, because our Excel, we will never be able to calculate. And from Google form also, the graphs which we will get are just, some pie charts and even bar charts. Those are not conclusive, and we will land up with the wrong results, or maybe, elusive results.
Exactly. Now we need to use some statistical software, not just only basic Excel. Excel, the purpose of Excel for data entry. Sometimes we can do some basic calculations. Yes. But data entry we can use.
But sir, I don't know. I think none of us must be using the SPSS software, or people must be using only Excel at this moment to show the colorful graphs.
We'll do some webinar regarding this usage of our SPS, how to use
SPSS. Yeah.
We'll do some more webinar.
That definitely. And I like that idea of conducting knowledge attitude kind of study for.
First, we need to assess our quality professional.
Yes. We can
before
do
going to physician
really
and
nice
nurses.
study.
Nice study. CAP study, knowledge attitude practice. We can do
this,
study.
This is also we can do knowledge attitude and the practice about quality practice, about quality among
culture,
quality professional. Yes,
something we can do that. We can float the studies, and we can publish on based of our organization. IHADA, we can do that also.
If we do like this, definitely we can able to create awareness,
because we have to create research survey. There is no research in India, so we are not having any research, and we have no way to benchmark our stuff also. We are only relying on our Western data. So I think we should initiate, being a statistical organization. I think we should, and I have my hand up for that. So I'm your candidate number one. You tell us, you give us guidance how to go. Give us give us a guidance, sir. We formulate a questionnaire and we can circulate. We can do it, sir.
So may I say one
we must do actually.
Yes, Doctor.
Yes, sir. Yes, sir.
It will be very nice with various setting,
Huh.
multiple setting. If we do it, very nice. It will be.
Lot of opportunities for research, ma'am. Lot of
Yes.
opportunities.
Yeah. So we should
Sir,
do that.
may I add a sentence, sir?
Yes,
Yes, sir,
sir.
doctor. Yes, doctor.
Yeah.
Please go ahead, doctor.
Sir, I'm very interested in the survey of patient safety,
Mhm.
but I want to learn it practically in the field of ophthalmology. I
Okay.
want to learn the safety culture in an eye hospital. How do we
Sure, sir.
survey this?
So we'll do
Very
separate
interested for this,
webinar
sir.
or we'll do separate webinar or course for ophthalmology. How to do the survey in ophthalmology setting. Sure, sir. Definitely we'll do in future.
Sir, I have attended your earlier course on this patient safety culture development also.
Yes.
But I'm still not that confident to do the
Okay,
survey
okay.
in a hospital. I
Sure.
want to be confident in this. I want to have a deep knowledge of the subject. I will request you to kindly conduct some program for this, which
Sure,
I will
sure, sir.
definitely attend. I'm interested
Definitely.
for this.
Sure, sir. We'll do, sir. We'll do more collaboration.
Thank you, sir.
Welcome, sir. Any other questions from others, please? This is more important. This slide is more important. Most of things I took from AHRQ and JCA, even from some other international practice, before survey, because the response rate is more important.
Mhm.
So if you focus all these points, probably we can able to get more response, like 80%, 90%. Yes. Any other questions from others, please?
One point, sir.
Yes, sir.
Somebody in our session asked for the culture safety for eye clinic.
Mhm.
So just a point that AHRQ also has a culture safety tool for ambulatory care in daycare centers.
Exactly. Yes.
That might
There
be
is separate
applicable.
tool. Yeah, there is separate
Sir,
tool
where is
for
it, sir? Where is it, sir?
from AHRQ, sir. AHRQ, Agency for Healthcare Research and Quality.
HRQ. And where can
Yeah,
we find it, sir?
Yes. If you want, I will share in the group, sir.
Kindly send it in the group, sir.
Yeah,
I'm interested in that.
Sure.
HRQ.
Yeah, AHRQ, Agency for Healthcare Research and Quality.
Sir, even I would like to mention, sir, just day before yesterday, I did a presentation on e-conference, an international e-conference, that is evidence-based practices in patient safety. Where is this website now? AHRQ. Very nice information is there, and I think there are learning modules
Yes,
are also
yes.
there. I
Yes,
was
yes,
really
yes,
impressed, and I shared that
Yes.
resource in that
Yes.
e-conference. It is really nice.
Exactly. There are a lot of things available in AHRQ as well as
Yes.
IHI also, Institute for Healthcare Improvement.
Even modules are there, learning modules are there, na? Like self-paced.
Yes.
This
Yeah.
AHRQ stands for?
Sir, Agency
Agency
for
for-
Healthcare
Agency,
Research and Quality. For Healthcare
Quality,
Research and Quality.
Right, sir.
Any other questions from others? Okay. Thank you all. Good night.